Um, all right, so this is for Boyce 230. Um, and I'll also be doing another review at 10 o'clock on Thursday morning. If of course, if you can't make this time or the next time, just you can email me if you have any questions from the review. So I'm going to work off. I updated um the shared OneDrive folder with an updated review. It's pretty much the same review that was posted in a previous semester for 230, and I'm still using the review that was created by former student, Boyce student Maddie Kessie, and because she modeled a really good study guide and something you can do. Um, and if you have the time and want to do it yourself, you could put together something like this. But all she did was she went through the blueprint and just created questions from the blueprint and found questions. And then I've tried to kind of fine tune it, add a few things, maybe change the wording a little bit on some of these questions. But it's a really good breakdown of a review. So you guys are in 230. You should already know all your conversions. So I don't think I need to go through those. We might want to practice a few, but the big thing that we want to probably practice that's going to be new this semester is the heparin and insulin flow rates, as well as the heparin drip rate calculations. So I'm going to start with those because those are the new things. And then we can go back and do any of the other things that are listed. So you're going to see a lot of the same questions that you saw in your first and second semesters where you had your basic conversions, milligrams to micrograms, grams to milligrams, milliliters to liters, milliliters to ounces, teaspoons, tablespoons, pints, cups, quarts to ounces. And the big question will be the intake question with how much liquid intake and calculating that in milliliters. Students, and I think this is a good strategy, have converted everything to ounces first and then multiply that number by 30, and that gives you your milliliter answer. I just want to make sure because I had a student that was using incorrect information. Um, they were using 1 pint equaling 500 milliliters, but that is an incorrect number, and especially when it comes to being specific. I don't know ultimately if 20 milliliters makes a big difference as far as fluid intake is concerned in general, but when you're coming up with your final answer, if you're using 500 milliliters instead of what they want you to use, the nursing department wants you to use 480 milliliters, then your answer is going to be off by 20 milliliters at least, depending on what else you do. And then if you used 1,000 milliliters for a quart, now you're off by 40 milliliters. So just make sure you're using these numbers. These are the correct numbers. Unless you've been told otherwise, these are the numbers that you should be using. 1 cup is 240 ml or 8 ounces. 1 pint is 2 cups, which is 480 ml. And then you can see the rest. All right. You're going to have your oral-based meds. At this point, I think you are pretty strong with those. Remember, oral-based meds just means you're either calculating a tablet or a milliliter, right? Tablet, capsule, or a milliliter. How do you distinguish? Well, if it's something that's going to be, now it says by mouth, that could be tablet, that could be capsule. But then when they tell you that the pharmacy is giving you the strength is 80 milligrams per milliliter, that's your clue that you are getting it's a liquid, right? Anything that has a volume associated with it is going to be a liquid dose. So even though you're likely to see questions that'll just say how much of this medication will you administer, and it won't tell you specifically milliliters, that's your clue now, and you know that you're going to be looking for milliliters. Okay. Um, We'll see some weight-based medications. This might be a good one to review just because it have been a little while since you've done this. So I'm going to go ahead and work through this question here, number 2. where, and before I get to some of the other things, just because this can be somewhat new, or you might just need a refresher. So this is considered a two-step problem because you have to do two things. You have to convert the patient's weight in pounds to kilograms, and then you have to multiply that kilogram body weight by the order, which is 3 milligrams per kilogram, in order to find out how many milligrams to administer. And then ultimately it wants you to calculate the milliliters. So what we're going to do is we're going to take the patient, okay, that weighs 73 pounds. And what we're going to do is we're going to convert that to kilograms. So if you don't remember, 1 kilogram is 2.2 pounds. If you're like me, you pretty much just take 73 divided by 2.2. So don't feel like you have to write out exactly what I'm writing out, but it gives you the baseline. Now, some people will say to, not to do what I'm about to show you, which is just kind of make this a one step, get an answer, and then do a second step. But I always like to chop it up just to show you that either way you do this, you're going to get the correct answer. But when you do this and you take 73 divided by 2.2, you don't get an even number. You get 33.18 repeating. And I've been taught that you would just round to the nearest tenth as far as that's concerned, okay? So I'll show you also that you can get the same answer at the end of all this without doing the rounding. You're still going to get to the same answer. You still round at the end, but this is just an extra step. So if you've been taught differently, or you know that your instructors specifically don't want you to do what I'm doing right now, then just wait and I'll show you the alternative way of doing this. Now, once you have the patient's weight in kilograms, you're going to multiply by 3 milligrams per kilogram. And then you're going to get, so 33.2 times 3, and you're going to get 99.6 milligrams. And then now you're just going to solve like you would do any other oral-based medication. You're going to, if you like to do ordered over available, you can do that. I'm just going to stick with the theme of dimensional analysis, but you can do this however you see fit. So 50 milligrams, 2 ml. Don't forget, especially if you're doing ordered over available, that it's 2 ml, okay? A lot of times you'll just out of like habit put 1. Make sure you're paying attention to what that quantity is, okay? So 99.6 times 2 gives you 199.2, and it's going to be divided by 50, and what we're going to get is 3.984. Now, you're going to round to the nearest tenth, but that when that number is 8 and this is 9, what that does is it bumps the whole number up to 4 milliliters. Okay, so you wouldn't leave it at 3.9. You will round it up to the whole number because the next number after 9 is 10, right? Now, if this way you don't like feels too choppy, you can do this all as one long dimensional analysis. I don't know that you need to do this or not, but sometimes people like to see it, okay? So I always say there's no one specific way to set this up. It's just this, my strategy is I'm talking in my head what I'm doing. I want to convert pounds to kilograms. I want to convert milligram per kilogram for the medication to milligrams, and then I want to solve for milliliters. And so that's kind of the strategy that I'm thinking about in my head as I'm setting these things up. So I already have an idea of a direction of where I'm going before I put any values, okay? So I've eliminated pounds. I'm in kilograms. I don't want kilograms. I want milligrams. So that's where that 3 milligram per kilogram body weight comes in. And then ultimately, I don't want milligrams. I want milliliters. So I'm converting milligrams to milliliters. So you'll see that I'm using the same numbers, right? So I took this step I took this step, and then I took this step, and I just condensed it all into one thing. And then before I do any kind of math, the only unit I have left is ml. So that's kind of the value of doing dimensional analysis. Again, if you're getting the right answers and you're doing this differently, then by all means, go ahead and do however you're going to do. Now, without doing the rounding of the weight, let's just see what this comes out to be. So I'm going to take 73 times 3 times 2, which gives me 438. Then I'm going to divide by 2.2 and then divide by 50. And again, I'm going to get the same answer, 3.981 this time, but I'm still going to get a rounded answer of, and my final answer of 4 milliliters. So again, my purpose of showing you these two ways is just to let you know that whichever way you do it, you should be getting the same answer. And if you're like at 3.99, 3.98, whatever that, if it's 0.9998, you're at the whole number, okay? If it's 3.91, then it's 3.9. I think if you are off by 1/10 of a milliliter, you're probably fine. But, this says it's a child. I think you guys do pediatrics this semester. So when you do pediatric dosages, they want you to be more specific and more particular because they're tiny, right? They metabolize differently, and so the rules might change just a little bit, but you're not following the pediatric dosage calc rules for the 230 dosage calc test, if that makes sense. All right. So let me move down to um, what I think is going to be more of the challenging stuff. And you'll notice that some of these things, those of you who've worked with me previously, you've seen some of these questions before. I kind of use the same flow. A lot of it is just making sure we're keeping um, to be consistent, try and change the numbers up a little bit as needed. All right, so let's look at the heparin protocol. So the heparin protocol is just a protocol that's based off of patient's weight and then a set of procedures. Now, sometimes those procedures are listed out in a table format. You'll see that more at Allegheny campus. But I do believe that you'll see a question that looks more like this, where they'll just kind of give you the details. But there's a lot of information here, and they're going to ask you two questions. At least that's how we do it at Allegheny campus. We're going to ask you two questions. They're going to ask you to calculate a bolus dose and calculate a flow rate based off of the information listed. So what the information says is that you're going to follow this protocol. You're going to bolus the patient with heparin, and then this is why I practiced this previously, 80 units per kilogram body weight. So right off the bat, you're going to, when you see anything per kilogram, you have to account for the patient's body weight in kilograms. So that might mean it's already given to you in kilograms, or you have to convert the patient's weight in pounds to kilograms. So that's their bolus kind of starting dose, just like in that previous question where we took the patient's weight in kilograms times 3 and we got 99.6 milligrams. That is the order based off of the patient's weight. That's what we're doing here. We're finding out what the order is. Then it tells you to start a drip, which is a little bit confusing because we're not calculating a drop rate here. However, when we get to our final answer, you'll see it's going to be something like 10 milliliters per hour. So technically, we are calculating a drip rate, but we're not looking for drops per minute. We're looking for milliliters per hour. Okay. Could we convert that to drops per minute? Yes. If they gave us the tubing information, then we could probably do that, but they're not asking us to do that in these questions. So the initial rate is also going to be based off of the patient's weight. It's 18 units per kilogram per hour. Okay. Now, again, anytime you see kilograms in the denominator or as part of your order, you're going to be multiplying by the patient's or incorporating the patient's weight. whether it's in pounds, you convert to kilograms, or patient's weight in kilograms. Then we look at our availables. Our available is we have a 25,000 unit, 250 milliliter half normal saline available. And then we have a bolus available of 1,000 units per milliliter. So we want to make sure we're paying attention to all those details. So what I'm going to do is I'm going to highlight the important kind of numbers here. So 80 units per kilogram, 18 units per kilogram, hour, the 25,000 units, 250 milliliter half normal saline, and then the bolus dose of 1,000. So the order repeats the protocol. So you're seeing that same information, right? 80 units per kilogram, 18 units per kilogram per hour. It's just repeating the protocol. Now it's going to ask you two questions. Okay. And so like I said, I'm pretty sure this is how your test will be as well. I know this is how we do it at Allegheny campus, but basically you're going to get asked two questions: calculate the bolus, calculate the infusion rate. And those two questions will count as one question. So like, let's say you miss both questions, you've only missed one question, but you're not going to miss any of them because I'm going to show you how to do it and you'll be fine. All right. So the first thing is, and I want to just double check that this is correct. The first thing is we want to take the patient's weight in pounds, convert it to kilograms, and it looks like it's already been done. Okay. So 178 pounds to 80.9 kilograms. I just want to make sure that's correct. So 178 divided by 2.2. Okay, so 80.9 kilograms. So we're going to work with that. So I always say before you do anything, when you're doing these types of problems, convert pounds to kilograms. That's already been done for us. So I'm going to take the 80.9 kilograms. And the first thing I'm going to do is I'm going to multiply by because I'm calculating the milliliters for the bolus, I'm going to go ahead and calculate the information I need for that. So what was our bolus information? 80 units per kilogram, right? So that's what I'm going to do. I'm going to put 80 units per kilogram. Now, again, I'm going to show this to you in the chopped up way. You can do this all as one long formula if you want. I'm just showing you how this is. I'm not going to go back and show you both ways because I showed you how that worked in the previous problem. Just practice these, and if you're messing up or you're getting the wrong answer, 2 out of 3 times, let me know and I can help fine tune your math. But what we're going to do is we're going to take that 80.9 and I'll multiply by 80, and I'm going to get 6,472 units. Now, if the question said how many units to administer, you'd be done. That's not what it's telling us. It's telling us it wants to know how many milliliters. So the next trick to this heparin protocol question is, how do we convert units to milliliters? Do I have a way to convert units to milliliters? And the answer is yeah, because essentially this is what we're doing anytime we're doing any kind of oral-based med calculation or liquid-based, even though this is technically an IV-based solution, we're always going to be converting, whether it's milligrams or units or milliequivalents, to milliliters. Okay, so what do we do in those situations? We look at our available. So what's our available? Our available says we have 25,000 units and 250 milliliter half normal saline. Okay, so that sounds to me like an IV bag. And it tells me specifically a bolus dosage strength of 1,000 units per milliliter. What are we calculating? Bolus. So what number should I use? I should use the bolus dosage strength. So I'm going to put 1,000 units, 1 milliliter, plug it into my calculator, and I'm going to get 6.472 milliliters, and we're going to round that to 6.5 milliliters. As a reminder, when you're doing your rounding rules, if you don't recall, is any number greater than 1, round to the nearest tenth. If it's a number less than 1, round to the nearest hundredth. So like if you have 0.456, you would round that to 0.46. And then the only time you really don't use rounded numbers is when you have something like drops, because you can't give somebody a partial drop. So you just calculate to the full drop. All right, so that's a bolus. Now, the second part of the protocol is doing this thing called the infusion rate. Now, I'm going to show you some practice problems because you'll have some of these, but basically what this is asking you to do, once we get to it and you'll see what I mean, you're going to be converting units per hour to milliliters per hour. That's what it's asking you to do. So you're familiar with getting to milliliters per hour for calculating flow rate. You're also familiar with going from milliliters per hour to drops per minute because you've done that already as well. So this is just another conversion type of activity where you're taking the units per hour and converting it to milliliters per hour. So how do we start? Same way we started the previous one. We take the patient's weight, same patient, same weight, 80.9 kilograms. Then we're going to multiply by the order, and the order said to start an infusion or start a drip at 18 units, and then per kilogram per hour. So we got rid of kilograms here. Didn't show you that here. I always like to cross my units out. So 80.9 times 18. So let me plug that into my calculator. 80.9 times 18. I'm going to get 1,456.2. 1,456.2. And then what's left over? Units per hour. Now, some people just prefer to kind of keep the hour over here. I'm going to show you why I'm doing this in just a second. Okay. So what I want to do is I want to convert units per hour to milliliters per hour. So in order to do that, I need to have two pieces of information. I need to have units and I need to have milliliters. Same kind of thing that I did up here, right? With my bolus dose, right? But I'm not calculating a bolus. I'm calculating an infusion rate. What's the infusion rate connected to? It's connected to the IV. What is our available IV? Well, we have heparin 25,000 units in 250 ml. So I'm going to put the 25,000 units here and the 250 here. And then what I'm going to do is I'm going to multiply across the top, divide by 25,000, or the shorthand is 250 over 25,000 is the same thing as 1 over 100. And the only reason I know that is because I've been doing this for way too long that I have it memorized. But if you don't want to do it that way, just go ahead and take the 1456.2 divided by, or times 250 divided by 25,000. And what you're going to get is 14.562. And that's milliliters per hour, right? Because we got rid of units and we're left with ml an hour. Oh, there we go. You're still there. Hold on, my computer just went black, so. Okay. So what we're going to do is we're going to take that 14.562 milliliters per hour and we're going to round it to 14.6 milliliters per hour. 14.6 ml per hour. Okay. So the trick with this is nothing changes with these questions. The only thing that really changes is the patient's weight. So one of the things and one of the strategies that I've encouraged students to do is take your body weight or a friend's body weight, a parent's, significant others, kids' body weight, maybe not kids, try and keep it adults. Um, Convert that body weight pounds to kilograms and then um, plug it into the calculations. For a standard heparin weight-based protocol, you're always going to start off with calculating a bolus at 80 units per kilogram and starting a drip at 18 units per kilogram per hour. That doesn't change. Okay. And your available also seems to be fairly consistent. 25,000 units, 250 ml, and a bolus dose of 1,000 units per milliliter. Are there variations to the protocol? I'm sure there are. And if there are, then you just follow whatever those variations are. However, saying that, at CCAC, I can tell you that I've not seen um, alterations to these standard weight-based protocol like orders and availables. But once you learn how to read these things, I think you'll be fine in general. So I did create some additional questions using basically the same information. So like you have a patient that's 100 kilograms, they change some of the variables up. So they give you the infusion rate. They ask you to calculate milliliters per hour based off of this infusion rate. And so they give you the information, but notice this is a 500 milliliter bag with 25,000 units as opposed to a 250 milliliter bag with 25,000 units. So they changed the variables up a little bit. So there's some extra practice here where the variables have been changed. Same thing down here. Now they're telling you some additional information like increasing your rate. So like if the original rate was 18 units per kilogram per hour, and then it tells you to increase by 2 units per kilogram per hour, the trick here is to know what that means. What that means is we were at 18, now we're going to increase by 2, so my new calculation is going to be based off of 20 units per kilogram per hour as opposed to the original 18. Don't make the mistake of just doing 2 because if you're increasing it, the number should be greater, right, than what you were doing previously. Meaning, like in the previous question, we got an answer of 14.6 milliliters per hour, right? So that 14.6 milliliters per hour, if I increase the rate, it should be a number greater than 14.6. Now, does that mean it goes up to 16.6 or 20 or something like that? No, it might only be a few decimal points increase, which is why you have to do the math. Don't just assume that it went up by 2 whole milliliters per hour. It's probably not the case. Okay. Um, I'm going to come back to these because I think these are good to practice, but you can see there's a bunch here. Now, here's what I wanted to show you. This is a common question that you might see on your test before you get to the heparin protocol, and that is converting units per milliliter, which is what we were just kind of doing, to oh wait, I'm sorry, that's not what I wanted to do. Converting milliliters per hour to units per hour. Okay, so this is actually kind of the reverse of what we were just doing. So you can go from units per hour to milliliters per hour. That's what they did down here, units per hour to milliliters per hour. This is going from milliliters per hour to units per hour. So let me work through these two problems just so you can kind of get a feel of how to set up these types of questions when you see them. There's a bunch of shortcuts. Well, there's a bunch of ways to kind of wrap your head around it. Ultimately, as long as you're getting the right answer, you're doing it correctly. So just continue to work on these. If you're not getting the right answer or you're not sure you're getting the right answer, that's a great thing to ask me. Okay. So I'm going to start with this one since we just did a similar question. So some people decide, hey, we're going to start with, doing, um, we're going to start with doing the milliliters per hour and then kind of fill in from there. I always start with what is given to me and then work my way that way. Ultimately, like I said, as long as you're getting the right answer, you're doing it right. So how I start this off is I'm going to take my 1,000 units per hour, and then what I want to do is I want to convert units per hour to milliliters per hour. And so before I even look at what I have available, this is what I'm looking for. Can I convert um, units to milliliters? Do I have a way to do that? And so what I'm looking for is that information. So it tells me heparin, 20,000 units in 500 milliliters dextrose 5% water. So I have a conversion. I'm going to put my units with my units, so 20,000 down here, and then my milliliters up here. And then I'm going to find out what that comes out to be. So what I'm going to do is I'm going to take 1,000 times 500. I get 500,000. I'm going to divide by 20,000, and then I get an answer of 25. Now, what are my units that are remaining? I have milliliters, I have hours. What was I looking for? Now, I didn't really specifically say because it just says, how will the IV pump be set? The IV pump is they want to know milliliters per hour. In number 18, we actually get the same information, 20,000 units of heparin, 500 milliliters, but they're telling me that the infusion is running at 50 milliliters per hour, but they want to know what would it be in units per hour. This is just kind of um, helping you see that there's different ways in the practice kind of doing these conversions. I don't know that you're doing this in real life or not, but it's a way to kind of get you thinking, I guess. But I'm going to take my 15 mil per hour and I'm going to convert. Now, down here, when I did number 19, I was looking, how can I convert units to milliliters? Here, I'm looking, I want to convert milliliters to units. So notice that I'm writing my um, units alternately or differently than what I did down here. But putting those there before I do any kind of calculations, I already know I'm in the right setup because I'm left with units per hour. So all you got to do then is transfer down your IV, the 25 to 20,000 units in 500 ml. So what goes down here? Milliliters. What goes up here? Units. And then plug it into your calculator. So I have 20,000 units times 50, 1 million divided by 500, and I get 2,000 units per hour. Now, if you look at the problem we just did previously, we got 25 milliliters per hour for 1,000 units per hour. So if I were to double that, 50, it would make sense that I'm going to get 2,000. Okay. So if you ever are getting stuck on some of these things, just try your best to say, hey, what would this like? How can I make this seem or make this easy for myself? And some of that is just by remembering that, or by looking at some of these other problems and seeing like, oh, okay, that was double this, or that was half of this. And then at least you'll know you're in the right ballpark when you're coming up with your answers. All right. All right, so there was a couple other infusion rate questions. These are a couple more down here. So why don't I work through a few of these just so we can kind of get a little extra practice if you feel like you need it. Not still doing it. Um, all right. Just so you kind of see these, um, and then practice these as needed. So this says that the MD orders your patient to start an IV drip at 12 units per kilogram per hour. So what I'm going to do is I'm just going to highlight the kind of the orders. So notice that this is not the standard heparin protocol. This is some other protocol that they're following to administer a loading bolus of 60 units per kilogram. Okay, so they're telling you some different things than what was in the standard heparin protocol. You're supplied with a heparin bag that reads 25,000 units, 250 ml. So that's your available. Um, Patient weighs 189 pounds. And then it says, what is the flow rate? Now, notice that in this question, it doesn't ask you anything about doing a bolus. So you're not calculating a bolus here. Also, you wouldn't be able to calculate a bolus milliliters because you do not know what the bolus dosage strength is. And you can't just assume it. Okay. So if it doesn't tell you it, then you can't necessarily answer it unless, like I said, you've been told that 1,000 units per kilo or 1,000 units per milliliter is the bolus dosage strength and that there's no other variations to that, but I doubt that's the case. So I'm going to take my patient's weight. It's 189 pounds, and I'm just going to convert that to kilograms. So I'm just going to do that right on my calculator. I'm not going to write anything out. So 189 divided by 2.2 gives me 85.9 kilograms. 85.9 kilograms. So the first thing I'm going to do is I'm going to get rid of kilograms. I'm doing an infusion rate, and it's telling me that it's 12 units and then kilogram per hour. So we're getting rid of kilograms. And when I get that 85.9 times 12, I'm going to get 1,030.8. And that's units per hour. And then this is going to look familiar, right? I don't want units per hour, I want milliliters per hour. So the question I'm asking myself is, how do I go from units, get rid of those, to milliliters? I'm going to do so by looking at what I have available. What do I have available? 25,000 units, 250 ml. So I'm going to put the 25,000 with the units and the 250 with the ml. And then I'm going to get an answer of 10.308 ml per hour. And we're going to round that to 10.3 ml per hour. So again, all I'm doing is following the information. These heparin protocols are a little bit of a beast because they're asking you to combine several skills that you've learned over the last 2 semesters, in semester 1, semester 2, and now with this being third semester, they're asking you to kind of pair some of these things together as you are striving to learn and put this stuff together and understand it a little bit. But I think with practice, you're going to be just fine. So we have about 10 minutes left. Um, I've gone through a couple of the heparin protocol questions. They are time consuming, but I wanted to ask if you had any specific questions you wanted to look at or any type of question you want to look at. You can type it in the chat. You can unmute and ask. I'm happy to work through anything. And if you don't have any other questions, I have at least one other question I wanted to work through. All right. So I'm going to go ahead and work through this one because this one, I don't think you're going to see a question like this, but if you can do it, you should be able to do just about any other question that you encounter. And you're likely to see questions similar to this when you're calculating safe dosage ranges for pediatric dosages. You want to know what that means. So what a safe dose range means is just that you have a high end and a low end, and you want to make sure that whatever's being prescribed is going to fit within that range. If it's above the range or below the range, if it's above the range, it could be toxic. If it's below the range, it could be ineffective. And so if you're in those, if you're out of range, then it's probably not safe to administer that particular medication. And so then you consult with the physician to make sure, that that's the way that they want to go. So saying that, we're going to kind of do a similar thing here, and this involves a couple of different steps, and it's a good one to kind of end on. So the question is, we have a medication here that is going to be titrated from 15 to 200 micrograms per minute. So it's got a range, okay? The IV solution is made by adding 50 milligrams to 5% water. So it's 50 milligrams, and then how much water is the 250 ml. So we need these bits of information in order to kind of make our calculations. And then it wants to know how you should program your infusion rate. You're going to start at 1 milliliter, one set of milliliters per hour, and then ultimately get up to the final milliliters per hour. So you're going to have a range. So what we're going to do is we're going to calculate these ranges. So my recommendation when you're dealing with something like this is to take the number that you're wanting to work with and just kind of separate them. So that way you can kind of go through. So what we're going to do is we're going to find out an answer for 15 micrograms per minute and an answer for 200 micrograms per minute in order to get to a final answer of the low end milliliters per hour to the high end milliliters per hour. Okay. So knowing that, I always say, like, even without having an idea of what numbers you're going to use or how you're going to get there, kind of thinking about where you're starting and how you're ending, that's at least gives you some information to work with as you're kind of trying to figure this stuff out. And I know it's challenging. So you're going to take that 15 micrograms per minute, and there's a couple things you can do here. You can convert minutes to hours. You can convert micrograms to milligrams. You can convert the 50 milligrams to micrograms. There's a couple of different strategies you can do here. So I'm just going to pick one and just kind of roll with it. What I'm going to do is, the first thing I want to do is I'm just going to convert, because I want to make these microgram numbers bigger numbers. So I'm just going to convert minutes to hours. And how do I do that? I'm going to multiply by 60 minutes per hour. So I should have written this a little bit better, but I didn't. So these minutes cross out. I should have written these underneath here to make it a little bit clearer, but hopefully you're okay with that. So I'm going to take 15 times 60. I'm going to get 900. So this is 900 micrograms per hour. And then 200 times 60 is 12,000 micrograms per hour. The next thing I want to do, and again, this is just my preference and just kind of what I'm deciding to do. You can decide to do just any number of different ways, but I'm going to convert micrograms to milligrams. And the reason I'm doing that is because my availables in milligrams. I could also convert my milligrams to micrograms and then just do that one time. So that is one way of doing that, but just because we have the opportunity, I can show you some conversions while we're doing this. So that's why I'm going to do it this way. So I'm going to convert micrograms to milligrams. 1 milligram is 1,000 micrograms. So I'm going to do the same thing down here. 1 milligram, 1,000 micrograms. And then what I'm going to get is 0.9 milligrams per hour. So micrograms are gone. Micrograms are gone. And here I'm going to get 12 milligrams per hour. Now all I have to do is convert the milligrams per hour to milliliters per hour, and I'm going to do so by multiplying my available. Oh, freeze on me here. All right. So I'm getting rid of milligrams, converting it to milliliters. Same thing here. So I look at my available, 50 milligrams, 250 ml, 50 milligrams, 250 ml. And at the end, I'm going to be left with milliliters per hour on the low end, milliliters per hour on the high end. So let's see what that comes out to be. So I'm going to take 0.9 times 250. And that gives me 225 divided by 50, and I get 4.5. So on the low end, 4.5 ml per hour. What about the high end? 12 times 250, which is 3,000, divided by 50, which is 60 ml per hour. So what does this mean? Basically, what this means is that we're going to start off with an infusion rate of 4.5 milliliters per hour, and then we're going to work it up to 60 milliliters per hour in order to address or in order to fulfill the order that is given in this particular label. So those, or at least that's the kind of the review questions that I had wanted to go through, at least today. Some of you might be able to catch the recording, and then if you have additional questions, and can jump on the 10 a.m. Thursday session, then we can ask more questions. We can go through more heparin protocol questions. But if there are no other questions, then I'll go ahead and wrap it up there. And like I said, I'll be doing Boyce 230 review again on Thursday at 10 a.m. All right. And if I don't see you on Thursday, good luck on your test. Again, please feel free to email me if you have any other questions.